because the mechanism of injury to break the femur, it's a larger bone, you're going to have other injuries, internal, head injury, C-spine. So most of the time, we're not going to worry about a fractured femur. It's all the other things we're worried about. But when you do, you guys are going to have to know how to use it. Okay, so the sinker traction splint comes with this piece here, and it's got a rod on it that comes out on a ratchet. And please be careful with this, because this will come straight out and hit somebody on the head, okay? So make sure that this is locked in and doesn't come out, okay? So there's one piece there. And then you have ankle straps, and each ankle strap you have left and right. You have a figure 8 strap, and you'll see where that goes in a little bit. And you have several leg straps that strap your legs to the splint itself, okay? So if you look at your skills sheet, one of the first things, of course, after PPEs and you introduce yourself, one of the first things you're going to do is explain to the patient what this is about, okay? You're going to verify by cutting the pants and finding the injury and verifying that it's a mid-shaft femur fracture, okay? After you see that, then you want to do your CSM, okay, on both legs so that you get a baseline on your CSM. And then the next thing you want to do after explaining to the patient what this is for is you're going to take this part right here, and it's going to go into the femoral area to the crotch, okay? It's going to sit up against there. Which leg do you want to be fractured? Okay, you're right?
Yeah.
Okay, so I'm going to have him slide right up against your crotch. Go ahead and adjust yourself to make sure I'm not squishing anything vital, okay? And that's going to go right up against there. Then I'm going to secure the thigh strap first. That didn't work out so good. Let me see. Let's go like this. There we go. Okay, now come under. Go ahead, push it. There we go. Okay, then we're going to tie in the strap. Go up as high as you can. You want to try to grab as much as you can so that when you pull on the splint, it doesn't slide down the leg. Okay, so the next thing you're going to have is the ankle strap. So it says right, and if you look on here, it says R for right, okay? The buckle is always going to go on the outside of the ankle, okay? So like that. So you want to be able to have access to it. And of course, you know, you're going to take off the shoes when you do your CSM. So we're going to slide this right under the ankle. Now, these pads here, you can adjust, take one out if it's a smaller person, okay? But he has a boot on, so I'm just going to go ahead and use all the padding. You want it tight enough so it's not going to slide off of the foot. Then you take this strap and you run it through the metal piece here. It's nice and flat and even. And then you tighten it up. It's going to go about 1 inch past the heel. So I want it just tight enough, snug, so that when I push on this or pull on this, it's not going to move, okay? All right. So now we're gonna ask the patient how much he weighs. We're gonna go 10% of that in pounds. And if you look at the Sager splint on the left-hand side, the black marks are the pounds and the other side is metric. So we're gonna go a maximum of 15 pounds. So anybody over 150 pounds, we're just gonna go 15 and that's it, okay? So we grab the red handle, bring it up, and where that arrow points, and you guys can come up closer if you want to see, that's where we're going to, that number 15, okay? The other hand is going to go on the ratchet here, so that when I pull on it and I let go, it doesn't come back and crushes crotch, okay? So how much do you weigh?
170.
170, so we're going to go 15, maximum 15, okay? Okay, so let's say we're at 15 right there. Make sure that locks. Then put our handle down. We're good. Now we have traction on him. Now we'll relieve some of that pressure that the muscles are doing by contracting. Okay, we have different size wraps here. That one is going to go around both legs. Let's see, the next up here. I usually set them out. It kind of helps me to figure out how long they are. All right, so the first one I'm going to put on the ankle, shorter one. And anytime we have metal up against the leg, we want to pad, okay? So I'm going to slide this through and kind of put it between the leg and the splint. So we have a little bit of padding there. Okay, so one at the ankle, one below the knee. And you can also use his socks to pad the metal pieces right here, okay? Okay, and then one above the knee. Okay, let's put your legs together, please. There we go. Okay, so this last one is going to go around both legs to help splint both legs together. Now the nice thing about this splint is that if you have two fractured femurs, you can do them both with this because you have the two ankle straps, okay? All right, now the last thing we're going to put on is going to be the figure 8 strap. So the figure 8 strap starts behind the ankles, okay? Like that, and you cross through, come back around, and this will pull the feet together. Now we're done. Now we just take another set of CSM vitals and we're good. And then we would further transport him by putting him on the backboard and transporting him on the backboard. Any questions? Okay, good. So practice that then.